Despite widespread demand, it's nearly impossible to find a rapid test in some parts of the country.
Don't even know really where to get them or where they're available.
It's definitely discouraging, especially at this point we're 2 years into the pandemic.
Sydney Pagan spent weeks trying to get her hands on one in Ontario. She still hasn't found any.
It would be great to be able to have more access just to ensure that we are being safe.
Let's be honest, this isn't how anyone wanted to be starting 2022.
The federal government is trying to meet the need, promising to quadruple the number of rapid tests sent to the provinces and territories last month and deliver 140 million this month.
We have the tools we need to get through this new wave of the pandemic. Let's continue to exercise caution.
Before Christmas, it was like the Hunger Games trying to get a rapid test.
The opposition says the announcement should have come a long time ago.
We have so many incredible tools that we could be using to find the right balance to manage COVID if there was federal leadership.
As provinces and territories work on distribution, there are still questions about how to best use the test.
If you tested negative in the morning, that doesn't mean that you may not test negative, later on.
Medical experts say the jury is still out on how effective rapid tests are at detecting Omicron.
It's not quite clear if you're truly negative, and there sometimes, of course, can be false negative tests.
An imperfect tool, they say, is still useful.
If you have a positive rapid test, you're positive, like full stop.
The government hopes these shipments will help ease the burden on the overwhelmed public testing system by helping Canadians manage this latest wave at home. Olivia Stefanovich, CBC News, Ottawa.
And joining us now is Dr. Danielle Martin, a family physician and chair of the Department of Family and Community Medicine at the University of Toronto. And as we can see, you are busy working this evening. But let's talk about rapid tests. You know, a lot of people want to get as many rapid tests as they can. From your perspective, how useful are they?
They're useful, but they need to be used in the right way. So I think we're going to see in this Omicron wave a lot more use of more frequent rapid testing for people who have no symptoms in particular kinds of work environments and perhaps even in schools as a way to try to pick up people who have infection but no symptoms or very few symptoms. And then the other way that we're going to see the use of rapid tests is if you have a symptom of COVID-19 and you take a rapid test at home and you test positive, you should assume that you have the virus. In other words, we won't need to be doing as much confirmatory PCR testing. So symptoms plus a positive rapid test means then you have to isolate and behave as though you have COVID-19 and do all of the things that we know you should do in that circumstance.
So here's the thing. What if you have some symptoms, you're not sure if you have COVID or not, and you take that rapid test and it is negative?
And in that case, then you can't completely rely on those results. What we do see is sometimes people will test negative. They may test negative for even a few days, and then eventually that test will turn positive. They may test negative on a rapid test and then later test positive on a PCR test. So that is the circumstance where we would say you can't fully rely on that negative result. If you have symptoms, then you need to behave as though you've got the virus. At this point, there is so much spread of Omicron variant that we have to behave as though we have that infectious COVID-19 virus, even if that test comes back negative.
Dr. Martin, always nice talking to you. Thanks.
Thanks, Ian.